News Channel 8 presents New Skills for Living with your host, Tom Lavin, a healthy plan for healthy living.
Hello and welcome to New Skills for Living, a show dedicated to healing and wholeness in our community. We're very glad that you're joining us today. If you're a college student or a parent or a grandparent or aunt or uncle or friend of a college student, I think you'll want to watch our show today. It's going to be really good. You know, when we think about people going to college, we think that it's a time of learning and growth and it's a lot of fun. And of course it is. It can also be a stressful time, and sometimes college students can be tempted to be unmindful or to make stupid mistakes. So we're going to be talking today about the importance of mindfulness and being aware and really using the college opportunity as a chance to grow and develop fully as a human being. We have a great guest, Dr. Jacqueline Pistorello. Dr. Pistorello has done our show before. She and Dr. Victoria Follett had written a book on trauma, and Jackie came and talked with us about her book at that time. Now she's written another book, Mindfulness and Acceptance for counseling college students. And this is a really good book, and I highly recommend it. And Dr. Pistorello is going to spend some time talking with us about this. Dr. Pistorello is editor of this book, Mindfulness and Acceptance for Counseling College Students, Theory and Practical Applications for Intervention, Prevention, and Outreach. It's published by New Harbinger, and it illustrates how acceptance and commitment therapy and other mindfulness-based and acceptance-based approaches are utilized in helping college students. Dr. Pistorello is a research and clinical faculty member at the Counseling Services of the University of Nevada, Reno, where she has worked with college students for over 15 years. She has been awarded multiple grants from the National Institutes of Health, to research the prevention and treatment of mental health problems among college students. Dr. Pistorello, it's so great to have you back here on New Skills for Living.
Oh, thank you so much for having me,
Thanks for
Tom.
being here.
Yeah.
So, of course, the first thing we'd like to ask you is, can you tell us a little bit about what brought you into counseling college students 15 years ago?
Yeah, that's a very good question.
Yeah.
Before I came to UNR, I actually was not working with college students. I was working with a lot of women who were in their 40s or 50s, and I would hear over and over again, they're saying, I wish somebody had taught me some of these skills of mindfulness and so forth earlier in life, because things had kind of snowballed and then they ended up on disability and hard to dig themselves out of those holes. So I thought, well, I want to work with college students.
Yes,
It's a population that I can start intervening with earlier before things get problematic.
And can you kind of tell us then how that developed, Jackie?
I had graduated from UNR, and then I was back east at Brown University, and an opening came up at Counseling Services. That was 1998, and I came back and started working with college students, and I love working with this population.
Of course, when we think about college students, we think about they're in the classroom learning, and then they're out there having fun, which hopefully they are.
Yeah.
But sometimes there can be some problems or challenges or difficulties, and there are at UNR and every university or college across the United States, students are seeking or they're having problems or difficulties, and that's when they come seek you and your colleagues out. Can you tell us a little bit about that college isn't just all fun and games?
Yeah, that's a very good point. It's a little bit of a myth that everybody thinks, oh, you know, college is the best time of your life and it's all fun, fun, fun. And that's actually the case for, I'd say, 2/3 of the students. There was a multi-campus study just done by Cornell University, and this is with thousands and thousands of college students, and that they found that 59% indeed do not meet clinical levels of distress. That's 59%. But that 35% do, and that 6% are actually would be classified as languishing.
That is a 41% of students.
Yes, are in quite distress. And if you look at, there are several surveys, particularly within the U.S., in terms of the last 12 months, and what we find is that 50% of college students nationally would meet a diagnosis at one point in the last 12 months, 50%.
What are the more common difficulties or actually diagnoses that college students might receive?
Yes. You know, in some of these surveys, they found that 31% said that they were so depressed that they had difficulty functioning.
Yeah.
Approximately half said that they were experiencing such severe anxiety that it was difficult to function. 7% said that reported they experienced severe suicidality in the last 12 months. Another 7% engaged in what we call non-suicidal self-injury, which is like cutting or burning or punching walls.
Yeah.
And 1.2% actually report having attempted to kill themselves. And 1,100 college students die by their own hands every year in the U.S. And this is just in the U.S., but in fact, this is a problem worldwide.
Yes.
You know, Canada has just commissioned a task force to study that.
Yeah. Well, that is some very interesting information, kind of alarming statistics, though, especially out there if you're a college student or a parent. Right after this brief break, we're going to continue to talk with Dr. Pistorello about how she and her colleagues help through mindfulness and ACT therapy these college students that are having problems. Hello and welcome back to New Skills for Living. You'll see up on your screen the website easeap.com. If you would like to watch Dr. Pistorello's interview, it will be on the website, and there are over 30 other interviews there dealing with stress and anxiety and depression with people like Dr. Steve Hayes and Kelly Wilson. So please go to the website to watch those interviews. And then I also want to remind you, those of you that have seen the show before, if you're watching it just for the first time, there are over 90 newsletters on the website, again, dealing with acceptance and commitment therapy, how to do a mindfulness meditation, dealing with depression, healthy eating, good parenting habits. So please go ahead and access these newsletters if you'd like to. So Dr. Pistorello, you were describing really some alarming statistics that 41% of college students are having some real problems in college. And I was wondering, when you and your colleagues do the research, and of course you spend time talking with the students, in this wonderful college atmosphere, why are these problems emerging and developing?
It's a good question. At this point, it's theories, you know, nobody can prove or disprove these, but a college context can be pretty stressful. You know, these days an education is pretty expensive, so some of the students feel a lot of pressure to, you know, to do well by the money that their parents are spending. Also, you know, if they live in a residence halls, you know, a lot of folks do better actually in school if they are in residence halls. But for some individuals who are not used to being in very close quarters, and maybe who lack some social skills or have some propensity towards anxiety, it can be a pretty stressful environment. I hear often from students the situation where it's Saturday night, they're in their dorm room and they hear people going by and laughing and talking, and they're by themselves, isolated. So if people are having difficulties, this context can actually magnify some of those problems.
Yes, they could.
Yeah.
And sometimes there are problems with alcohol or drugs or other maladaptive coping mechanisms that college students might engage in, maybe for the first time, because they're away at college, huh?
Yeah, it's a time of great freedom. And actually this period between 18 and 25 has been recently coined emerging adulthood, because it's a period of experimentation where people figure out, who am I if I'm not with my parents, or if I'm not just saying what my parents say or think. So it's a time of a lot of exploration, and it's hard to know what to do with all this freedom the first time around. So sometimes students sort of engage in behaviors that are not necessarily very effective for them in the long run.
So Jackie, within this context then, for these students who might be having problems or challenges, ACT and mindfulness seem to be such an effective therapeutic intervention. Can you tell us why ACT and mindfulness can be so helpful?
Yes, I think ACT is particularly well suited for college campuses because ACT is transdiagnostic. So it's not just about people who are having depression or anxiety or eating disorders, but any problem, including things that are not really in the clinical spectrum, like choosing a career. You know, ACT can be helpful with that in terms of values clarification and so forth. But I think both ACT and mindfulness-based approaches are more useful to college students in general because of the fast pace that our culture is engaged in. we used to have to go through the process of learning to sit with difficulty and wait for things. And these days, I know that even myself, if I'm on the computer and the connection is not fast, it's like there's this kind of, you know, so I think mindfulness might be the way that the culture is using to counteract some of these processes, to teach us and to teach young folks how to get back to the present moment, how to slow things down, how to learn to carry some of these difficult thoughts, feelings, memories that we usually have.
We have about a half a minute. Can you talk a little bit about the role of acceptance in a half a minute, Jackie?
Sure. A lot of these problems that I was telling you about that college students may experience, like suicidality, non-suicidal self-injury, substance abuse, usually emanate from having difficulty sitting with discomfort of some sort. So if people have a relationship breakup and they feel sad, they start drinking, for example. So that's experiential avoidance. The counter to that is experiential acceptance. That's where acceptance comes from.
So that's an important thing that you teach the college students to accept themselves and accept what is as it is.
Yes.
And we're going to continue to explore these concepts right after this brief break. Hello and welcome back to New Skills for Living. We're talking with Dr. Jacqueline Pistorello, the author of this book and main editor, Mindfulness and Acceptance Counseling for College Students. We're talking about the difficulties that college students can have, but there is also help and hope through ACT therapy and through mindfulness. So Jackie, would you tell us some of the programs and offerings that you have for the students at UNR?
Okay, great. Yeah, ACT is being used all over, not only the US, but the world, but we are also the developers here in Reno, which is kind of neat. And we are taking ACT not only inside the therapy room, but outside. UNR, I think, is ahead of the game, along with several other universities in the US, in terms of looking at mental health of students in a broader way, not just waiting for the people who come to counseling, but also trying to reach out to folks who may need counseling but wouldn't come in. And actually, we know that 80 to 90% of the 1,100 students who eventually kill themselves every year don't come to counseling. So we want to find ways of reaching out, and ACT has been a great venue for this.
Oh, great.
Yeah. So one of the things we did, we got a very large grant from the National Institute of Mental Health, is we created an ACT class.
Oh, great.
We call it A to C, Adjustment to College. And we carried it at UNR from 2008 through to 2011, and we actually provided it to 732 college freshmen. And what we did is we embedded into a classroom format a lot of these concepts of acceptance, values clarification, mindfulness, and so forth. And the idea is, can we prevent some of the problems from taking root or getting exacerbated if we teach these skills to college students right off the bat?
How did you integrate that into a classroom?
Yeah, it was a team effort because actually it was a study, but we also, and the grant paid for the book and the credits, so that was advantageous to students because we wanted to offer it to everybody, and so that financial difficulties wouldn't be a barrier. And then we worked with the enrollment at UNR, and we created a class called Psychology 299. It was a 1-credit class, and then the students took a survey and volunteered and participated in the class. It was 2 hours long for 8 weeks.
Great. And
then we followed them up. And so far we've looked at satisfaction ratings, and students really like the class. There were some folks who were concerned because ACT is very experiential. And we do things like sitting across each other and looking at each other's eyes to sort of see what comes up. And the students loved it, actually. Nobody ran away, upset or anything like that.
So along with the satisfaction surveys, did you also do you have any outcome studies, or?
We are still analyzing the data to see. So far we're not seeing differences because there were 2 different types of classes. One that was based on ACT and one that was more psychoeducational, but also geared towards mental health approaches. And we are not finding differences between the 2 approaches. But we haven't yet analyzed the data in terms of, like, if you're exposed to mindfulness and acceptance and then later you experience a lot of stress, would ACT help minimize the impact of that stress? We haven't done those analyses
Where the
yet.
student considered that to be like in their toolkit, and they could pull that back from the class and use that in their life. Huh?
Yes, like does it really function as a prophylactic?
Yeah.
We don't know yet. We haven't looked at those data yet.
So you were telling us a little bit about acceptance and experiential acceptance and experiential avoidance, but can you describe mindfulness for us?
Yes, mindfulness is something that is borrowed from the Eastern philosophies and religions, but it's basically present in almost all religious traditions if you look at it closely. But the way Kabat-Zinn has described mindfulness is controlling your attention, not what you see. So, for example, if I'm sitting here and I'm doing the TV show and I feel some anxiety, I don't try to not feel the anxiety. Instead, I focus on something that I value, which is talking to you and sharing it with the viewers, and also coming back to the present moment. So those are some of the features of mindfulness.
So you're teaching the college students then through mindfulness to just be present to whatever their experience is and not try to avoid it, because by trying to avoid it, then they cause more suffering for themselves.
Absolutely, you're right on. That's exactly it. You know, because often when we experience pain, psychological pain, we do all sorts of things to try to push it away and suppress it, like drinking or whatever. And usually all that happens is that we add suffering to pain. So the idea is here, can we minimize the impact of pain? Because pain is ubiquitous. We all experience pain at some point in our lives.
We have about a half a minute, Jackie. Can you, the second part, of course, is about choosing and committing values. Can you talk about values clarification as part of ACT?
Yes, that's great. It's a great population to look at this, because when students leave home and they're 18, and it's a time to figure out what it is that they really care about. In ACT, sometimes we ask questions like, if you were alone in an island and nobody would know what you actually did, what would you choose to do? So we have several metaphors and questions like that that we use with college students to try to help them figure out what matters to them. Another way is to say, whom do you admire? Like, who is the person that you admire? It could be some figure, you know, national or local.
Yes. Those are some excellent examples, and we'll continue this interview with Dr. Pistorello right after this brief break. Hello and welcome back to New Skills for Living. We're talking with Dr. Jacqueline Pistorello, the editor of Mindfulness and Acceptance for college students. Jackie, you've been telling us about acceptance and also about commitment, and the last part, of course, is about taking action. Can you tell us about how important that is for college students?
Oh, it's important for all of us, really. It's this idea, you know, it's not acceptance for its own sake. That's what some people think, oh, just feel your feelings. No, it's not like that. It's about feel your feelings so that you can do things that matter to you in your life. And the concept of values is a direction. We often talk about it as like east, west, or north, south. And then there is an outcome that you might want for college students. It might be getting a degree, for example. And the problem is that often we get off the path. You know, we were sort of like all of a sudden we're doing something that is not really the best thing to getting the college degree, let's say. So in ACT, we talk a lot about that, how this is a process, and how, you know, the important thing is sort of notice that we are getting off track and then bringing it back to what it is that we want to do and taking action. Perseverance is really the most important skill, and that's one of the things that we teach students, is not getting so caught up in like, am I failing or not failing, but like what kind of person do I want to be, and where do I want to be at the end of this?
That's excellent, Jackie. Now, for college students who will be watching this, either this show itself or they'll be watching it on the website, do you have any advice for college students?
Yeah, when we do peer mentoring that is ACT-based, and one of the main messages that we want to communicate, get out there to students, is that psychological pain is ubiquitous. We all experience that. In college, sometimes everybody looks so happy, and you think, oh, I'm the only one, I'm here. And that is not the case. If you take a poll, most of us experience pain at one point or another in our lives. We all will. So if you're in pain, just remember that you're not alone. Even if other people look like they're not suffering, chances are, you know, 1/3 of your colleagues are. So keep that in mind in terms of not judging yourself so much for how come I'm sad when everybody's happy and stuff like that. So just remember that, you know, you're not alone, and also if you can let go of the judgment and just seek help if that's severe enough.
And I guess along with with perseverance, patience is also important too, that there are some longer term goals that a college student might identify, and to not get discouraged, right, Jackie, and just kind of take their time and one step at a time. Can you tell us a little bit about that perspective?
Yeah, actually there was some studies done some time ago with little kids. I think they were like 5 or 6. I don't know if you've heard about this study. And they gave them a choice. Here's a piece of candy and you can eat it now, or if you wait 5 minutes, you can have 2 pieces of candy. And the kids who were able to wait 5 minutes and get 2 pieces of candy actually did better in college years later.
Yes, I was in that study, yeah.
So, that is, you're absolutely right. Patience is a key factor, sort of being able to sit with the discomfort of not having something right away, you know.
And mindfulness, of course, can help with that. Now, we started off talking about, we said there may not just be college students watching, but parents or grandparents might be watching too. We have like a minute and a half left. What advice would you give to parents or grandparents or aunts or uncles that are watching this?
It's been really surprising to me, but parents are incredibly influential with college students. We have this idea that by the time you get to college, all that matters is peers. And it is up to a point. But when you ask students, whom do you want to talk about something really serious, not just a relationship, issue, but something really serious like depression or suicidality, almost all of them say parents.
I'm surprised to hear that.
Yes. Actually, there are several studies recently that, for example, if you look at the relationship with a parent, is predictive of better adjustment in the first year in college.
How about that?
Yeah. And so, that might be important for viewers to know, that it's not just peers. We still count as parents.
It's important because parents, we might actually minimize and say they don't want to listen to me or they could care less, when in fact they might really want to speak with us, huh?
It's that balance. You don't want to be what we call, helicopter parent, too much intrusiveness, but you also want to communicate, I'm here if you need me.
Yeah. This has been a great interview, Jackie. Thank you so much for coming back to New Skills for Living. And you'll see up on your screen is the website, and you'll be able to watch Dr. Pistorello's show on the website, as well as other great guests. We want to ask you to join us again next month. And again, Dr. Pistorello, thank you so much for coming and sharing your wisdom.
It was a pleasure.
Okay, it was great. It was great, Jackie.
Thanks.